Hi everyone, hope you're doing well today. We'll be taking 5 minutes to review continuous glucose monitors or CGMs. The goal today is to give you a practical overview of the most common systems you'll encounter. Specifically, we'll talk about the Dexcom G7 and Freestyle Libre 3, covering how they're applied, how we track the data, and what key insights to look for. So let's quickly compare the main players. First, the Dexcom G7. This is a real-time CGM, meaning it constantly measures glucose and pushes data automatically to a compatible smartphone or the Dexcom receiver. It has a 10-day wear duration with a 30-minute warm-up period, and that warm-up period is essentially the time from when the sensor is first put on to when it starts transmitting data to either the phone or the receiver. It's known for its customizable alerts for high, low, and predicted low glucose levels. The sensor and transmitter are combined into one disposable unit. So the sensor is what's actually checking the blood. The transmitter is the device that's sending the glucose results to the phone or the receiver. Data uploads to the Dexcom Clarity platform for our review, and it also has connectivity options with some insulin pumps. You should be watching out for a 15-day sensor hitting the market in fall 2025, as that was recently approved by the FDA. The second one is the Freestyle Libre 3, or the newer Freestyle Libre 3 Plus from Abbott. This is also a real-time CGM sending glucose readings every minute directly to a smartphone app or the Libre receiver. The Libre 3 boasts a 14-day wear time and a 60-minute warm-up period, where the Libre 3 Plus is actually prescribed for 15-day wear time and is compatible with the automated insulin delivery systems. So like the G7, it provides real-time alerts. The data uploads to the Abbott Libre View platform. And of note, the regular Libre 2 and 3 will be phased out by next fall, so it's probably a good idea to get in the habit of prescribing the Libre 3 Plus version, which is the one that you can wear for 15 days and is compatible with automated insulin delivery systems. A key point for both systems is they are factory calibrated, meaning routine finger sticks for calibration are generally not required. They both have capabilities to provide alerts for hyperglycemia and hypoglycemia thresholds, which can be customized for patients depending on their current glycemic management. Applying these sensors is pretty straightforward. It's gotten easier to apply them over time, but proper technique is still important for accuracy and adherence. In site prep, the standard approved site for both is the back of the upper arm. Ensure the patient chooses an area without scarring, tattoos, or irritation, and that they rotate sites with each new sensor, so rotating from left arm to right arm or at different sites in the back of the arm. You'll want to clean the site thoroughly with an alcohol wipe or a wet cloth and let it air dry completely before application. Moisture can interfere with adhesion and accuracy, so we want to be paying attention to that. For both devices, they have an all-in-one applicator now, so you just unscrew the cap of each device, press the applicator firmly against the skin, and then for the Dexcom, you need to press a button to complete the application. For the Freestyle Libre, you just lift it away. Once the sensor is applied, you may consider an overpatch to ensure adhesion over the 10 to 15 day period in which the sensor is on the skin. Those overpatches can be purchased via Amazon or several large retailers so that it sticks on the skin. As far as the software that's needed to correspond with the mobile application, they both have their individual apps, Dexcom G7 app or the Freestyle Libre Link app. Though it's less frequent over the last 2 to 3 years, it's still possible that a patient's phone doesn't have the capabilities to download these apps. So if this occurs, a separate receiver will need to be prescribed. So you'll send a separate prescription for the sensors and a separate prescription for the receiver in that case. So 2 separate prescriptions that the patient will need to pick up. For the Dexcom G7, the patient would open the application on their phone, and then they would enter a code that's found on the applicator, which follows the sensor warm-up period. And then for the Freestyle Libre 3, there's a Libre Link app. You essentially scan the new sensor via that app to activate the sensor and start the warm-up period. And then they need to connect to the clinic, which is really important for us to be able to look at their data in real time. So there's a Dexcom Clarity software system and an Abbott Libre View software system that we can log into and view the results. And we have a unique Midtown clinic code for each of those. And if you are interested in getting plugged into that, we can add you as a user to those codes. And then the final piece is interpreting the data. So we have the sensor on, we're starting to receive data. What are we looking for? First, we're looking for time and range. So this is the percentage of time the patient spends within their target glucose range. Typically, a patient's target glucose range is between 70 and 180 milligrams per deciliter. The goal for most patients is having a time in range greater than 70% of all of their glucose values. You'll also want to pay attention to time below range. Time below range for most patients is less than 70 milligrams per deciliter. Our goal here is less than 4%. Obviously, an ideal goal is 0% to help manage hypoglycemia. And then time above range is usually designated as greater than 180 milligrams per deciliter. Our goal here is to have those values be less than 25% of all total values in a 14-day period to manage hyperglycemia. The reporting mechanism for both devices is quite robust and can give you outputs regarding blood glucose averages in custom date ranges, single day reviews, and much more. We'd be happy to show you those screens in person. For patterns and variability, when reviewing these reports, things we often look for include consistent post-meal spikes, overnight lows, high variability, so big ups and downs consecutively, or relatively smooth glucose trend lines. Identifying these patterns helps tailor therapy, adjusting mealtime insulin, basal rates for insulin pumps, or various lifestyle factors like when to eat, what to eat, how to exercise, those types of things. The trend arrows on the apps or receiver also can predict short-term glucose direction and rate of change, which can help patients take acute action if needed. So treating a low blood sugar if they see their blood sugar trending below 70, drinking water, or avoiding additional sugar if they see their blood sugar is trending in that hyperglycemic range. The final value here is Glucose Management Indicator, or GMI. This estimates A1C based on average CGM data over the last 14 plus days. It correlates with lab A1C, but isn't identical. It provides a valuable snapshot between lab draws as we wait 3 months for that A1C lab. So that wraps up the overview for today. Don't hesitate to reach out to myself or Chelsea if you have any questions as you encounter these more in practice. Thanks.